And welcome back. I'm the Dr. Bob Lee from 107.5 WBLS. And our next guest is a brand creative global digital health influencer. He's right here on Open with us. He said, you know what? I want to come on Open. I want to let you know all that I'm doing. He joins us to provide updates on his documentary, Can You Replace a Broken Heart?, which he spoke with us about 1 year ago, highlighting public health, the public health needs in our community. So let's welcome him to the show. This is not his first time on the show. Well, if it wasn't this show, it was another show. So please welcome to the show, Mr. Carl McIver. Welcome.
Thank you, Bob. Thank you.
How are you?
First of all, I want to thank you. You've always been a wonderful supporter of our initiatives, and it's truly appreciative. And I just want to thank you.
You're welcome. So you have some wonderful things going on right now. Explain how Red began.
Okay. Red actually began for me about 4 years ago. But this initiative, Red Bloodless Medicine and Surgery, it really began way before that. I'm sure many people are familiar with blood management. Jehovah's Witnesses, they really didn't want any blood transfusions.
Right.
And thanks to the healthcare industry and the healthcare supporters, they developed different, let's say, protocols to be able to help them with that. So I looked at that and I said to myself, would it be fair for all of these wonderful inventions and initiatives to just help that group? Of course, it's great, but what about persons that aren't, that really don't want blood for whatever reason? Shouldn't they receive awareness? So that's when Red started. Red is basically to help to bring awareness to blood management, patient blood management, so that persons could be able to have a decision.
So the goal is to create an engagement bridge between healthcare providers and the patient consumer.
Exactly. Patient consumer. You rarely hear that term used.
Yeah.
Because usually healthcare goes directly to the patient. But we realize that the public needs awareness first, because from the public, they become patients and they're consumers.
Yeah.
So why not address them? So redbloodless.org, or our initiative, is really to help the public to see these wonderful different innovations in health, to be able to now become partners in making their decision with healthcare providers.
And it's good to know that before you go to a hospital. Be educated before you go into the hospital, because you can do some things.
It's true.
You can make some moves.
You can make some moves and decisions. Because right now, when you look at the whole environment of healthcare, you have to be more responsible for really what takes place for you.
Yeah.
And healthcare providers are, we could say, multidisciplinary partners in this. One of our initiatives is anemia. People really don't think about being anemic, but when you look at the global data, just about probably 75% of individuals anemic, they probably don't know it until it's too late, and they have to make decisions, let's say, on the fly.
What inspired you to get involved in this area?
That's a good question.
Not too many people know about this. It's just, if I have to get a blood transfusion, you just take me. Help me to live. But then, now there's something different where you can manage your own blood. What made you get involved?
Because I thought, being a Jehovah's Witness myself, we've always had the medical community really help us with our decisions to a certain degree.
Yeah.
But then I said, wait a minute. Is it fair because I deserve, I guess, certain treatment that persons that don't receive the certain treatment? So why not everyone? I mean, right now we're living in a time of diversity, inclusion. So what better inclusion it is so that everyone can be educated? Perfect example, that little symbol that has the crossed out blood bag. Why do we have that? Why not just have some type of symbol that really helps everyone to see they could make their decisions?
Mm-hmm. So to manage your own blood means to do what? How do you work that?
Good question. You're not managing in the sense that you're doing it by yourself. No, you're working along with your hospital team. And that's what redbloodless.org wants to do. It wants to bring these two partners together so that it's a positive decision making, not in the past where it was a demand. I mean, when you think of the no smoking sign, I was in a hotel the other night and they didn't have the sign anymore. It basically said on this floor was 100% smoke-free environment.
Smoke-free.
So isn't that a wonderful way of putting it? So we want to change the culture. So that's a positive culture, one that healthcare providers, whether it's your hospital, medical center, or universities, can work along with individuals, not just a niche, because since COVID, many people may not want to take blood.
Yeah.
But that's their personal decision.
But when you first mentioned manage your own blood, I thought maybe you were taking your own blood and storing it away somewhere.
Okay.
So that if anything happened to you in the hospital, you can use your own blood. But you're saying use your own blood in your body that's already there.
Excellent.
Is that right?
Patient blood management is something that the World Health Organization, it's a protocol that's being done globally. What we want to do is, if that is your personal decision, then that's your personal decision. What we want to do is let people know that whatever their wishes are, whether it's not to store their blood, to keep their blood, that's fine. But the hospitals are now in a better position to be able to satisfy your wishes and not place undue demands upon you.
Yeah.
So it's really, our initiative is a global one. And it's really, once again, it's to bring a positive and to bring awareness. Because think about it, how many people are aware that they may not need a transfusion?
Yeah.
That they could basically have, well, to the movie,
Yeah.
some of the most serious surgeries can be done without the use of blood.
So how is it done? That's what we want to hit the nail on the head.
Okay.
You know, is it using your own blood, or is it using your own blood within your body?
Excellent.
Or building your body up
Good.
so that you won't need a blood transfusion?
Excellent. It's actually both of those. We hope that you will work, or persons will bring awareness to need, so they can build up their blood, so that if they're in a situation that a surgery is needed, elective surgery, that less decisions have to be made that are critical. Now, obviously, I'm not talking about a car accident where a person, that's a different scenario. But what we're talking about is majority of people, if they can have awareness that they can. Now, using your own blood, there's so many different types of cell savers, so many different types of equipment. I'm not a surgeon, I'm not a doctor, but the hospitals have different protocols that can help you use your own blood if needed, if that's your wish.
Ah, okay. So, and that's what you're working on. You've been working on. What do you want the hospitals to know? Because you want people to climb onto this.
Yes. What I want hospitals to do is, we designed a symbol that's basically patient blood management symbol, so that when persons enter the hospital, they can actually see their rights and not be somewhat of a demand, but collectively working together. We've also designed a poster regarding patient blood management and what that actually entitles. Basically, what that means is that the hospital and the patient now work together for what you want, you see, and what your wishes are. Now, think about that. Doesn't that make for a better hospital environment? Doesn't that make for loyalty? Doesn't it now the less pressure off the physician, because they know they're working together?
Yeah. Where can we get more information about this?
Good.
Where
And
can we learn more?
in our movie, we have a movie now, Have a Heart, which is a movie based on a person that had a heart transplant without the use of blood. Redbloodlist.org. You can find me on LinkedIn. You can Google my name and it'll come up.
And when they Google it, they do what?
Carl McIver, Carl Lorenzo McIver. You could just type in top global patient blood management influencer. If you can remember that, you could find me.
Thank you. Carl,
thank you. Thank you
Appreciate
much.
All right.
Thank you.
We'll take a break right here. I've got more coming up next on Open. Sit back, kick off your shoes, and relax your feet.